I'm here with Tyrone, and he's a 65-year-old retired patient. He has a history of knee osteoarthritis. We just finished therapy with him, and he's reporting that he has moderate pain in his osteoarthritic knee, about 5 out of 10. So we plan to use biphasic pulsed current TENS e-stim on his knee for pain control, focusing on activating the A beta fibers for to utilize gait control theory to reduce his pain in his knee. Some of the indications for e-stim are having pain, especially chronic pain, is really good for. Also, the fact that he has osteoarthritis are all indications for this patient of why e-stim can be useful for him. Some contraindications for any patient for e-stim: if they have altered tissue sensation, they can't feel the e-stim; if they have impaired mental status; if they have an implanted electrical device like a pacemaker or something like that, we probably don't want to use it. If they have cancerous tissue and things like that, near the eyes is bad. Anywhere near the carotid sinus around the neck is not encouraged either. So those are some important contraindications. So like I said, for this patient, it'll be mostly focusing on pain control and utilizing gait control theory. So, all right, Tyrone, how's it going?
Good.
So how's your knee feeling after all that therapy?
It's a little painful right now. Probably say like a 4 or 5 out of 10 pain.
Okay, awesome. So it's pretty normal, especially if you have arthritis and you need to have that sort of achy pain. So what we're going to do is I'm going to use this e-stim machine, and I'm going to put it above and below your knee. And so it's going to focus the area in between the pads where I place them. So the purpose of putting the electrical stimulation, when I put it on, you'll just feel like a tingling sensation. I'll increase the amplitude, I'll increase the power of the e-stim just so that it's comfortable, but it should not be painful. It should just be like a comfortable tingling sensation. And basically just when we put this on, the sensation that it gives you basically overrides the pain receptors that are going from your knee to your brain. So instead of getting pain, it's getting the tingling sensation and reduces the pain you're feeling. Okay. All right. So is it all right if I place my hands like on your leg and knee area?
Yeah.
And place your pads on there? Okay. And we'll give you we're gonna give you your own set of pads because we expect that we'll be doing this a few times as you come to therapy. So you have your own set of pads that you use every time. Make sure that we keep them clean. Okay. And we got you up on a bolster here. Are you comfortable there? Do you need a pillow under your other leg or anything? You're comfortable?
Yeah, I feel comfortable.
Okay, awesome. And when we put you on this, we'll do it for about 20 minutes.
Okay.
Just for this first time. All right. Let's inspect the skin. So notice you got a little scab here, so we're going to try to avoid that if we can. I'll just go above and below. Your skin looks like it's pretty clear, so no swelling or anything, so it should be good. Okay, so for this patient, we're going to use biphasic pulse current. We'll do high rate TENS. For pain control, we're going to do a pulse duration of 80 seconds, pulse frequency or pulse rate of 80 pulses per second, and then we want to use an amplitude comfortable for the patient. So we'll do like a comfortable tingling, and we'll do it for 20. Yeah, it's usually 20 to 30 minutes, but we're going to focus on about 20 minutes since this is his first time. All right. So for our machine here, we want to hit start here. I guess it's already on. So we're going to do biphasic, keep it at normal. We want to do continuous. We want to be on, we don't really need any ramp time. For timing, we're going to go up to 20 minutes here. Pulse rate, we said we wanted 80 pulses per second. And then pulse width or pulse duration, we want also 80. You can do about 50 to 100, but we definitely want to keep it below 200 because we do not want any muscle contraction. So 20 minutes, 80 pulses per second, 80 microseconds pulse width. And then we'll turn up the intensity after we apply the pads onto the patient. All right, Tyrone. Got your pads over here. Have you been feeling your pain on one side more than the other, or is it through the whole thing?
Just kind of like a general throbbing, I would say, through the whole thing.
Okay. If you ever do, if it is like more on one side or another, just let me know and I can move the pads so that they focus more of that area.
Okay.
But today we'll just go through the whole thing. Okay, comfortable there?
Mm-hmm.
Great. Okay, so I got a pad just above his knee, and just below his knee. Bunch of baloney. Okay, sorry, it's terrible. Okay. So what I want to do is I'm just going to gradually turn up this intensity, the power intensity over here, until the patient feels comfortable tingling, and I'll just get patient feedback for that so I know what we're working with. All right, so I'm going to start turning up the machine. Let me know when you start to feel it. Starting to feel it at all yet?
Oh, yeah, there we go.
Starting to feel it now?
Mm-hmm.
Okay, great. Okay, you let me know when it gets to the strong but comfortable tingle. If it gets to pain, we'll back off a little bit and go from there, okay?
See about right there, a nice tingle.
Right there?
Mm-hmm.
If I go any more, it'll be painful.
Or
Or
probably do a couple more if you want. Yeah.
right about there?
Mm-hmm.
Okay, awesome. Okay, if you just let me know, I'll leave a bell with you. So if you need to get my attention, I can come turn it down or whatever. But if it gets like painful or uncomfortable, and nobody like comes to help, just take the pads off. Like there should be no problem with that. Okay, so we're on 40 here, and so we're just gonna hit start and give him 20 minutes of treatment time. We'll go for at least 30 seconds. All right. We have been going for 30 seconds here. All right, Tyrone, how is your knee feeling?
It's feeling a lot better.
Yeah?
Pain's gone down, yeah.
Okay, awesome. How's your comfort level of your knee been? How's the tingling feeling?
Yeah, it was good. Never really got in that painful area. It's always just a nice little tingle.
Okay, awesome. So I'm gonna turn off the machine here. Turn all that off and take these pads off. Sorry, it might be a little painful with any leg here can be uncomfortable. Okay, good. I'm going to put the camera back here. All right, let me look at that skin. All right, we got no redness, no, is it painful at all? Do you feel any pain afterwards?
Mm-mm.
Okay, perfect. Exactly what we want. And like I said, we're gonna keep these pads just for you to use next time. And hopefully, as we use this, your pain will go down and your knee pain will improve after each therapy session, so you won't need as much, hopefully. Okay, and then if you continue to have pain, like throughout the day, you let me know after our future therapy sessions if that continues to become a problem. We can use we can change some of the settings on here. It's a bit more of an intense sensation while you're getting the therapy, but it tends to last. The pain control lasts a little bit longer. Okay, but we'll cover that later if we need to. All right, we are all set.